are going to get started. Of course, you want to start by acknowledging the land, acknowledge yourselves for being here, and any animals that we have with us. I'm going to assume there's probably a lot of animals around. I know Ben and Alexandria have some, and I have EJ. He's in another room right now. He was tired, so that's what he's doing. He's sleeping. Oh, there you go. Not a dog, but Gluteus is here. I think that's Gluteus. Yeah, we are in Treaty 6 territory, Ben and I, in homeland of the Métis. And Alexandria is in Calgary, which is Treaty 7 region in southern Alberta and home to the Métis as well, the Métis Nation, and that's divisions 5 and 6. So again, super excited today. We are going to talk about some of the science behind what you're doing out in the community so many times a week, a month, what have you, with the dogs in your lives who are St. John's Ambulance Therapy dogs. And so we want to share a little bit of the science around that because you know the impact that it's having, and that's really important part of the discussion. And then we're also going to share a little bit about a course that we have available for handlers as well. So with that, we probably will be about 30 minutes and then lots of time for questions and discussion because we really want to hear anything that you have to share as well. So Ben, I think I'm going to, I'm not sure Molly's tired here. She was in rehab this morning, so you sleep, Molly. All right. I think, Ben, you only have access to sharing the slides, right? So we'll just say next, if that makes sense. Okay. All right, thank you. So I am Colleen. I'm going to give you a tiny introduction here to our Positive Connections Lab at the University of Saskatchewan and a little bit of context around the human-animal bond and animal-assisted interventions, which most will know, but again, I want to situate that within the science. Then Ben, who is St. John's Ambulance Community Coordinator, is going to talk a little bit about that science behind the dogs and what they're doing and that what you're doing out in the community, and specifically what we're doing here in Saskatchewan. And then Alexandria is going to talk more about the science and in particular the unique form of support and some of the science behind that. And she's going to give an example, a recent example. Most of what we're going to talk about today is animals in the healthcare setting, and in particular a hospital emergency department. And then we're going to do that wrap up. And again, really unique opportunity for all of us to have a time for discussion and any types of questions that you may have. The next one. So that's me and Molly, as you see Molly here, and there's EJ as well, St. John's Ambulance Therapy dogs. I've been a handler since 2013, and at that time I started with 3 other dogs, Hannibal, Kisby, and Subi. We have experiences ranging from the hospital emergency department to a hospice more recently, universities, prior visiting, and many thousands of hours of visiting, and then adding a research component to that as well. Any of the research we talk about today, you're going to see some of it on the slides. You can find at colleendell.com. All of our research articles are up there. But what's really unique about what our office or lab has been able to do is look at therapy dogs and the impact and the effectiveness and all those great things alongside St. John's Ambulance as a research partner. So we're really thrilled to be able to do that and now share some of this back with the community. We also look at service dogs. We focus on pets as well, most everything around mental health and addictions. Next slide. So this is our lab. You can go to positiveconnections.com. And you're just going to get a general overview there. It's co-directed by myself and Dr. Darlene Chalmers there in the middle with Ruby and Raina, and Dr. Lindsay Williamson on the other side with her dog, Steve. So our lab in particular looks at how human-animal interactions can improve can improve and enrich our lives as humans, but animal welfare underlies all that as well. We take a One Health approach, which means that we look at the relationship between animals, humans, and the environment. So if animals are not healthy, then humans and the environment are not healthy, and so forth. It's about all three being healthy for being a really strong whole. We focus on a concept within One Health called ZUEA, You may have heard of zoonotic disease, which is what One Health really mostly focuses on, and that's a transmission of disease from animals to humans. But we focus on the opposite of that, which is zooea. And again, zooea is, as you can see up there, the positive benefits to human health from interacting with animals. But in addition, we also look at the welfare of the animal. So that's really important. The next one. So underlying a lot of our work and what you see in the community is this concept of the human-animal bond. And the human-animal bond is this mutually beneficial and dynamic relationship between people and animals. And you can see a little bit more of the definition there, but really it is about that relationship and that reciprocal relationship, right? So it's about the animals and the humans and that interaction. So next. So that's one key concept. Another key concept in our work is animal-assisted intervention. And you may be aware of this definition: any activity that includes or incorporates animals to improve or for improvements in human health. And again, we always include animal health in there as well. So typically within animal-assisted interventions, there are animal-assisted activities and there are animal-assisted therapy. What we do as St. John's Handlers is animal-assisted activities. That means you are out there and visiting, and it may be therapeutic, but it is not therapy per se, okay? And then also we ascribe to the terminology of therapy dogs. Some people use wellness dogs, some use comfort dogs, but we're still wedded to therapy dogs for the very fact that they can be therapeutic in the work that you're doing out in your communities. Okay, now you're going to sit nice, listen. Okay, now I'm turning it over to Ben.
Perfect. Thank you so much, Colleen. Hi, I'm Ben Carey. I am currently the Provincial Coordinator for Community Services with St. John Saskatchewan branch. I've been involved with the Positive Connections Lab for, I think, about 6 years now. And I have also got the opportunity to do this job as well as still consult and be an active part of the research team at the University of Saskatchewan, which has been wonderful. I've been a researcher on a lot of different topics when it comes to the human-animal bond, mostly with service dogs and supporting mental health and addictions, and improving the accessibility of companion animals in rental housing, but specifically with therapy dogs and pain and hospital settings, which is something I'm going to get to talk about today. I don't have to say next slide because I'm controlling. There we go. So I just want to talk a little bit about the evidence of what it is that we do and what we're trying to share with you today. So we all know that our animals make us feel better. I've got my cat on my lap right now. He's helping me through this presentation. Colleen's got Molly sitting right there. But how exactly does this work? So on a psychological level, human-animal interaction, it actually can reduce our heart rate, our respiration rate. These changes can occur chemically, so the levels of cortisol, which is our stress hormone, and oxytocin, which is of course the feeling of love that we get when we look at our loved one or look at an animal that we love, increases, and they increase and fluctuate throughout these sessions. This is shown through a lot of different researchers. Peterson has shown that oxytocin levels increased and cortisol decreased when interacting with an animal, and that they continued on throughout a 60-minute session. They measured it at all different points of these sessions, and that not only would these levels change, but the animals and the humans could detect, kind of in a way, the levels of each other and their interactions and how they interacted with each other changed throughout the session. So if both of their oxytocin levels were lower, the human and the animal, the human would pet the dog more frequently during the visit, which is really something extraordinary. These physiological changes are indicative of relaxation of our parasympathetic nervous system, whereas our sympathetic nervous system, which is where our fight or flight mechanism actually kicks in, has been shown to decrease during these interactions. So it makes us feel less like we want to escape from whatever setting we're in, which is important because a lot of the settings we visit are settings where a lot of people would want to escape from. So I'm going to ask everybody actually at this point is what other benefits occur during a human-animal interaction? And I know that our chat has been disabled, unfortunately, but the Q&A session is still working. So if you want to throw in the Q&A, what benefits you think happen for us through an human-animal interaction? Obviously, the animals are positively affected as well, but what specifically do humans get out of the interaction? So I see socialization, which is great. Lower blood pressure, absolutely. Connection, comfort, joy. These are fantastic. Unconditional love, feeling of being loved. Emergency responders have some moments to be mindful and grounded, which is absolutely true. St. John Ambulance has their emergency responder program, and the therapy dogs go out with them, and they benefit those volunteers just as much as they benefit the people that they're serving. Sense of connection and non-judgment, affirmation, companionship. These are wonderful answers. More compassion towards others. I'm going to throw some of ours out here as well. So feeling unconditional love and support, which was absolutely listed there. Eased feelings of loneliness and depression, refreshed mind, decreased confusion, acceptance without obligation. Nobody accepts you quite like a therapy dog accepts you, and that's something that we've shown time and time again. Comfort that sometimes no words can offer, non-judgment, reduced pain, lowered blood pressure, calmed agitation, reduced anxiety, meeting the need for physical touch through petting, and reduction in sensory overload. On this one specifically, I've had a few people tell me that that's something that they, in very busy environments, nothing gets them out of that headspace quite like the texture and feeling of a dog's fur. But there is so much more, and the body of research is really only growing. And so we all kind of get all of this positive benefit from interacting with a dog, a cat, an animal. But one thing we really need to acknowledge is that not everyone has access to an animal in our homes like I do, like Colleen does, like Alexandria does. And that is something that, is so important. And that is exactly where St. John Ambulance comes in, to bring these dogs to places where pets and animals can't normally go, or to people who can't normally see them. So I'm going to talk a little bit now about therapy dogs in research. So our St. John therapy dogs have the unique ability in Saskatchewan to work with our research partners, which is the University of Saskatchewan, which is our team. And it has enabled us to say that almost all our therapy dog programming is evidence-based. This means that we use research to lead to positive outcomes for participants using program designing and planning processes. Over the last decade, we have taken St. John Ambulance therapy dogs into universities, care homes, correction facilities, and so many others, but most importantly, hospitals, to assess the positive impacts of integrating them into different settings. For example, taking surveys to see whether people want the dogs in the area, taking community stories about the positive impacts the dogs have had on the community, and studies on patient impacts on everything from pain to depression, as I'll talk about right away. So one of the first studies we did was actually looking at a case studies of the wait experience in an ED with therapy dogs. One of the biggest things that people struggle with in hospitals is the waiting, especially in Canada. We have some of the longest wait times, and it's all incredibly anxiety inducing. Sorry. So one of the early studies we were looking at is how these wait times impact people, and how therapy dogs can affect that feeling of, well, when am I going to get seen? What's happening with me? What's going on? Why is no one talking to me? I am sure that everybody here has experienced long emergency wait times, whether it was you or your family members, and they are only increasing as there are physician shortages, and for people who have nowhere else to go, like family doctors, for their health concerns. So waiting for hours in a hospital can feel extremely stressful, and you may be alone. You may not have family with you, and you're not going to be sure when you're going to get to see a doctor. So for this study, we just wanted to understand how the presence of our St. John Ambulance therapy dogs impacted people, whether it was in the waiting rooms or waiting on their bed as they were waiting to see a doctor. So we interviewed 124 patients through questionnaires, and they did that before and after visiting with our therapy dog. And there was a researcher doing observations of the interactions, making notes of any emotional changes or expressions of happiness on behalf of the patients. In conclusion, the study found that there were significant positive improvements to the patient after the visit, and that regardless of age or whether or not they had a pet or currently had one in their life. So the biggest takeaway from this study is that therapy dogs had the ability to increase patient comfort levels during their um, patient levels during their wait. And the patients indicated the dogs had a welcome distraction and helped with stress levels while they were waiting. As a result, the study really supported the need for further research on the role that therapy dogs can have in enhancing human healthcare experience all around. This is why our lab has continued to do additional studies and why today we're going to focus specifically in the hospital settings, as we would otherwise need hours to cover everywhere that we go. We additionally ran a study on patient opinion about therapy dogs in hospitals that was published just a couple of years ago that showed the vast majority of people felt positively about therapy dogs being in this space. I know that's something that we all kind of get concerned about is, do people want the dogs here? Are people worried about the dogs being in the space? And we really found that people do want these dogs and that they are happy, even if they're not interacting with them, that they're in the space around them in the hospital setting. So this was this first study that I got to run, which was the outcomes of controlled trial while visiting therapy dog teams on pain in adults in an emergency department. So it was a first of its kind controlled clinical trial. It was the first controlled clinical trial involving therapy dogs in Canada, and one of the first controlled clinical trials involving therapy dogs in a hospital setting in the world. We had 101 patients participated as a control group, and 97 visited as the intervention group. And what made it a controlled clinical trial was that we did the same questions on people that just interacted with some of our research assistants, as well as people that interacted with a therapy dog for 10 minutes, and then they were interviewed about that interaction immediately after, and then again 20 minutes later. And what we really found was that the people that visited with a therapy dog reported a significant decrease in their own pain, their anxiety, their depression, and an increase in their well-being 20 minutes after the visit when controlled to the control group. And that those increases or decrease of pain, anxiety, depression, and increased well-being continued on 20 minutes after the therapy dog intervention. So it had a lasting effect. We were actually able to make a video about it, which I'm going to share with you now. Let me just make sure. If anybody has trouble with the video or listening to it, let me know, please.
People go to an emergency department because of pain. Emergency departments can be busy and confusing places, and the resulting anxiety can make the pain worse. It's well known that spending time with animals can help humans relax, but can this happen in an emergency department? A team of researchers from the University of Saskatchewan, hospital patients, and policymakers are working to determine whether dogs benefit patients during an emergency department visit. In the first of its kind study, 7 St. John Ambulance Therapy
Sorry, I'm just trying to increase the volume.
Visited the Royal University Hospital Emergency Department in Saskatoon, Canada. This clinical trial looked at the effects of a 10-minute therapy dog visit on patients in an emergency department compared to no visit. Patients were asked a series of questions to assess their pain, anxiety, depression, and well-being before, immediately after, and 20 minutes after the visit. The study used a patient-oriented approach. People with lived experience of pain guided the research. Results showed that the group that visited with the therapy dogs had a bigger decrease in pain, anxiety, and depression, and an increase in overall well-being 20 minutes after the therapy dog visit compared to the group that didn't visit with the therapy dogs. This important study has shown that therapy dogs increase patients' comfort and decrease distressing emotions.
So that was an amazing study to run, and it was really great how it showed that that we were able to positively affect so many people across the emergency department. It was run just before COVID happened, and I think was a big part in allowing us to get quickly back into the hospitals as things were settling down after the COVID pandemic. Actually, and speaking of COVID, another thing that we ran during the pandemic was we wanted to see how therapy dogs helped reduce needle fear at a COVID-19 vaccination clinic. I think many different St. John Ambulance therapy dog programs across Canada were invited to the vaccination clinic. I think the one in BC was invited maybe first, and that's how our group got in on the idea, and we wanted to get there as quickly as we could, so we really mobilized and brought well over 10 to 15 dogs there at various times so that their mass vaccination clinics in the city could operate with as many dogs as they could, and they could not get enough of our dogs. They were there as much as they could possibly be. But what we really found, and we wrote a nursing practice article on this, was that the dogs fit into what the Canadian healthcare systems were using to address needle fear, which is the CARD system. So which is comfort, ask, relax, and distract. So the therapy dog teams and the dog specifically appear to offer comfort through perceived non-judgment and undivided attention, perceived presence and touch, and promotion of fond pet memories among patients was how they comforted. For ask, patients were asked if they would like a therapy dog present during an injection, in turn supporting patient self-efficacy. They were also asked questions about dogs and animals generally while waiting, wherein they allotted the opportunity to direct the conversation in a situation where they may not feel in control. For relax, it is suggested that patient can attempt to relax before and during their injection by focusing on the dog. And we really found that the patients intensely focused on these dogs to ignore any of these the scary stimulus, which is of course the needle and the scary waiting room and the scary mass vaccination clinics that were around them. So they were able to relax by focusing singularly on the dog, and they were encouraged to focus on petting the dog in unison with their own breath, which we found very helpful. And of course, and some of them hugged the dog during the injection, which they found very, very helpful. And then of course, distracted. Above all, the dogs distract the patients, including the novelty of having a therapy dog at the clinic, hearing the handler's stories about the dogs and patients, and asking dog-specific questions. So what can we take away from these studies? And I think the biggest thing that we can talk about when it comes to taking away things from what we've done is that when we are advocating for our program, when you're advocating for your therapy dog program, we have scientific evidence that our dogs benefit patient pain, well-being, unconditional love, everything. There is stuff that we have done and that the research community as a whole has done to prove that these dogs are here and it's causing a positive effect for everyone involved, staff, patients, community partners, everybody is getting some benefit from these dogs being available. The benefit was consistent across demographics and genders. That's something that my study focused on, is we got all of the demographic, gender, everything that we could from everybody that was participating, and we found very consistent results across all of our demographics. Our dogs have a lasting effect on patient well-being. So our dogs, you don't just get happy because you saw a dog and you're back to being where you were right after they leave. It has a lasting effect on your well-being. And our dogs have the impact beyond the hospitals, and we're always going to be offering new ways to support. And we really have to be open for when these new ways come and find us, because we don't know all the positive benefits that these dogs have to offer. And we're only going to find them by going to these new places and by exploring these new options. But that is it for me, and I'm going to hand it off to Alexandria now to talk about her research.
Awesome. Thank you, Ben. Can everybody hear me okay? Okay. So my name is Alexandria Pavlich, and I'm a PhD student working in the Positive Connections Lab, but splitting my time between Saskatoon and Calgary. I've been a St. John volunteer since 2019, helping with evaluations as well as program development. But now I focus exclusively on research, all about, what we've already been talking about, how animals help people, but specifically looking at mental health and suicide prevention. And I've been funded by the federal government, Mental Health Research Canada, and the Saskatchewan Health Research Foundation to do this work. And I also volunteer with 2 therapy dogs. They're sleeping behind me, so all I can do right now is show you their therapy dog cards. Zola and Marcus, we go into hospital, university, and shelter settings. Next slide. So, as Ben and Colleen have mentioned, the St. John teams have a positive impact in a variety of ways to a wide population. As a mental health researcher specifically, I really wanted to understand how it is that therapy dogs in clinical settings could provide support, specifically for the clients that are living with mental health and substance use concerns, but also how they might help the staff that are in this emergency department setting. So from the existing research, we do know that mental health patients often report feeling really isolated or stigmatized when they're trying to access care, which is why therapy dogs can be really important for them specifically. We also know the emergency department staff, they're currently experiencing high levels of stress and burnout due to operational limitations in most emergency rooms across the country right now. And we also know from research coming from other facilities, whether that be in corrections or rehabilitation centers, or even for veterans, dogs are excellent at providing non-judgmental support. So we really just wanted to explore this more closely. Next slide, Ben. And in a moment, I will explain some of this a little bit more in detail, but sometimes I think it's just better to hear it firsthand from someone. One of our participants, Lex, who has now joined our team as a patient partner and advisor, was actually interviewed by CTV News about our most recent mental health study that took place in June. So go ahead, Ben. If we have volume.
And thanks for joining us across the province. We begin tonight with a researcher at the University of Saskatchewan who's concluded her study into the effects therapy dogs have on patients in the emergency room. Noah Rashog has more on her findings.
For decades, specially trained therapy dogs have been assisting in the mental health field and are proven to have a profound effect. University of Saskatchewan researcher Alexandria Pavlich is paving the way for therapy dogs in the emergency room. She's conducted a study looking into their effects.
Really interested in if the dogs can help with mental health for the patients who are waiting, but also how it might help the staff and improve the environment of the entire emergency department.
The Royal University Hospital was one of the first hospitals in Canada to introduce therapy dogs to the emergency room. Lexi Rousel was a patient at the ER, and she testified to the program's effectiveness.
My brain was so fast and so set on one thing and couldn't really think of anything else. And then all of a sudden the dog came in and the handlers, and they came in, and my focus was all of a sudden just on the dog.
The study has consisted of nearly 50 hours of tests with 24 different patients. Results were shown to the Congress of Humanities and Social Sciences in Toronto.
I think it's just difficult after spending so many hours in the emergency watching what's happening in there for the last, 6 weeks, that I'm not understanding why more hospitals aren't integrating this, because it's such a complimentary and easy thing to do.
The project was just granted an additional $100,000 to continue their research. Noah Rashog, CTV News, Saskatoon.
So as we just heard, I eventually ended up doing over 60 hours of observation in the emergency room with the dogs present, where I was taking notes during the visits that were happening with patients and both with staff. Ben, thank you. Next slide. We visited with over 60 patients total and over 100 staff members, but we actually had 28 mental health patients specifically who were willing to sit down and also do a survey and an interview with me to help us understand how the dogs are able to help them. And of note, we kind of touched on this earlier, the wait time for the patients that we saw was 11.5 hours on average, which is way too long. That's really common for mental health patients since there are not always psychiatrists on staff or mental health nurses available to help them. And the primary reason that the majority of the patients that they were coming in for was actually suicidal feelings. So these patients, like Lex, were for the most part coming in at an absolutely terrible day in their life and a large proportion of our participants were also Indigenous. So for anyone who does visit with mental health clients, I'm sure you already know, based on your personal experience, this can be really different, simply because these folks are often in distress, their mind may be racing, as Lex said, or maybe they're just fully shut down. So it can be really challenging to talk to them and visit with them. But in the same breath, I'm sure you recognize how loving and non-judgmental your dog can be with them. You know, they just accept people for who they are and where they're at. So I just really want to emphasize, it's important to recognize that the support a dog provides is very unique and often very different from what a human or a nurse or a doctor or even a family member can provide, especially in a hospital setting. Also pictured here, we have Murphy, who you would have seen on the introductory slide. Murphy was actually the first St. John therapy dog to visit an emergency room in Canada, starting back in 2015 in Saskatoon. Murphy is still around today and actually helped on this study with their handler, Jane. So next slide. Basically what we found by introducing the dogs was that they were actually a catalyst to get people who were struggling to open up. You know, when I would initially go into a patient's room and ask if they would like a visit with a therapy dog, many of them were crying or shaking. Most of them wouldn't make eye contact. Some were in the middle of a panic attack. They didn't want to deal with a nurse, let alone talk to me. But as soon as I would mention dog, there was an instant change. Within 5 to 10 minutes of the dog being present and visiting with them, the patients were willing to make eye contact. Their tremors and crying stopped. They were smiling and even laughing at times. Some were also disclosing to us information they were not even sharing with the staff about why they had come to the hospital that day. So in terms of the feedback received directly from patients, we found similar things that exist in the broader therapy dog literature that we've mentioned. Everyone spoke to how the dogs brought joy and happiness. They were a welcome distraction. They explained how it helped them feel more calm and grounded in this really chaotic environment, especially for the patients who were presenting with anxiety. And that makes sense because we know that just stroking and patting a dog for a few moments can help take down those stress hormones and produce those feel-good ones. And again, the majority of the patients that we saw coming into the ED, they were alone. They didn't come in there with a support person. So they really said that the dog was able to provide support and a sense of connection from the isolation they were experiencing while waiting. But in terms of the findings for the staff, they were so excited and welcoming of the teams. As you can see here, many were happy to stop and take a photo. They were commenting on how much they needed this and how this was the best part of their shift. So I also observed how it was improving communication pathways in the department. The dogs were helping the distressed patients de-escalate and open up. So consults were easier and quicker for the staff, which is why many people say things like having a dog present during a therapy session can be really beneficial. So again, that theme of connection and improved social interactions was really prominent. The staff recognized the value of the dogs, and by the end of the study, they were even saying the therapy dogs were a part of the care team, and that was even being written into the clinical notes. So that's really, really significant. So in conclusion of this study and an overview of all of our emergency department studies to date, we are really confident in saying that, St. John Ambulance therapy dog visits can be a complementary social support service for a variety of populations. The science shows us that therapy dogs provide that opportunity for love and connection, especially in isolating or chaotic environments, and they are able to provide joy and happiness and that welcome calming distraction for people who may be struggling. And what we kind of feel is one of those most important things, again, is that non-judgmental support. We have a therapy dog course that Dr. Dell will speak to in a moment to help explain this and how you as a handler can help facilitate safe and supportive interactions as a team. I'm sure many of you already do this, but this course really came about because some of the handlers in Saskatchewan, they wanted to ensure they were providing equitable and inclusive visits for diverse clients whenever they may have crossed paths with them. So really the course, which I'm sure lots of you are already implementing a lot of these things, it's just tips and takeaways to help strengthen your own practice and also be mindful of the welfare of your dog. I learned so much from it. So lastly, it's really clear St. John Ambulance volunteers and their companion animals play a huge role in helping promote wellness in the community You already know that. I'm sure that's why you continue to keep volunteering. But now that you have a bit of the science and the evidence that has been gathered alongside the therapy dogs to help support this, you can go out and kind of share that with others. And we hope the information that we provided has given some more, data to help you make better sense of why your volunteer work is so impactful. And because of this and all the research we've done to date, we also feel it's really important for there to be therapy dog visitation standards, especially in clinical settings or contexts where people are feeling distressed or in a vulnerable position, even just in terms of simple things like hand sanitizing practices for clients and handlers, before and after visits to reduce the risk of zoonotic disease transmission, to keep the dogs and all the people that are present during a visit safe. And at this point, I'm going to hand it back to Colleen so she can tell you a bit more about that therapy dog handler course.
Great. Thanks so much, Alexandria. Yes, so based on all that experience that you heard about, Jane Smith and Murphy there, our first therapy dog visitors to the emergency department, they wrote a children's book called Murphy Mondays. You saw it on the first slide there. And I can't think of the word. The money made in part from that went to the hospital, and it also came to our team to create this course. So this is an 8-hour course, and it's online, and it's available and free to everyone. So thank you again, Jane, for that and making that available. It really is to raise your awareness and your skills about your own role, and more around self-care, also about the clients that you're working with or the people that you're visiting with, and then also the well-being of the dog, as Alexandria mentioned there. Yeah, someone's snoring back here, so I'm not sure if you can hear that. It's really loud for me. So this is what you can get by taking the course. There are 5 modules. There's that introduction. And then the first one here is you will become aware of your own biases regarding diversity. So things like culture. Alexandria said 40% of the RUH patients that we visited were Indigenous. So what specific cultural understandings do you need to have? Sexuality, race, social economic background, like just being aware and helping raise that awareness in our understanding is really important in our skills. And also making being committed to this inclusive therapy dog experience for everyone. And the really great thing about the course is in this area, we have a therapy dog handler who shares in the beginning how they didn't do that and how they learned from that. So it really, every module gives an experience where the handler is like, oh, I didn't think enough about that, but I'm so glad I am now. And this is why we want to share. We're always learning from our experiences, right? Second is understanding what mental health concerns from a trauma-informed lens is, and then being able to respond to a client's health experiences with a trauma-informed lens and really knowing what that means. Third is understanding the importance and practice of self-care and peer support for therapy dog handlers, why this is important and how you can do this. For example, making sure you take time for yourself and your dog following a really difficult visit. And sometimes the visits can be very difficult. And also the camaraderie that you have with fellow therapy dog handlers. And then really here identifying in our last module, the basics of dog language or dog body language, the importance of animal welfare. How do we make sure that they're feeling well after these visits that we do? And then helpful practices for them, again, after and during a session. The next slide. So this is just Jane here and Murphy, and they're talking about the course. So you'll see this on the front page. We just wanted to make sure we gave that recognition again of raising our own awareness and skills. And there's been really great feedback on the course. And I know even myself, once in a while, I'll pop into it just to remind myself of certain aspects and things that I need to keep in mind when we're doing our visits. And then that takes us to our very last page here. And this is time for any questions that you have. You can put in the question and answer, any thoughts that you have, anything you want to share. Ben, I think we only have this, we don't have it so that people can talk. It's only in the question and answer. I think it's only so that they can, put it in the question and answer so you can type it in. So yes, So one of the questions here is, how do we access the course? The course, if you go to colleendale.com, so colleendale.com, and then on there, you will see it's called Initiatives, and the course is right there. So
I
that,
did also provide, Daniel Martin had asked about the link as well. So I think everybody on your end can also see the answers that we give. There is also a direct link there if needed, because sometimes Googling and doing all the searching can be a challenge. So yeah, copy and paste that.
Mary Ellen is typing the link right now. Thank you, Mary Ellen. That's excellent. Or that might be Ben.
That might, yeah, I think that's me. I'm just
That's
logging
where Mary Ellen came from. That's perfect. Another question that people often ask is, can you get volunteer hours for taking the course? Because it is about an 8-hour course. And I know we allow that for us here in Saskatchewan, and I don't see why that wouldn't be a problem across the country. I mean, specific therapy dog course. So I would think that that would be applicable. So just ask your own therapy dog director or what have you. When is the course? Of course, it's free and online, so you can take it at any point now. You could go on tonight if you wanted. You can go after the webinar. Are your dogs in the program visiting Children's Hospital tested? Yes. So Ben, do you want to speak about that?
Sure, sorry, could you repeat the question?
Sorry, are the dogs in the visiting program in the Children's Hospital tested? So about children's testing.
Oh, yeah, no, of course. So the dogs that go to the Children's Hospital, or any event that involves children under the age of 13, when it primarily focuses on those ages, have to be child evaluated, which means that after a year or 60 hours, in Saskatchewan, I'm talking about Saskatchewan qualifications, I believe it's national, but I don't want to speak to that, after a year or 60 hours, we do an additional evaluation session. So in everyone's first evaluation, it's only adults, and we test them in various circumstances with other adults. And then at the children evaluation, we bring in a lot of children under the age of 13. Usually we like to have a wide variety of ages, and they go through a bunch of different exercises with the dogs around, whether it's running by the dogs, playing loudly with toys around the dogs, encircling the dogs, making sure that at every stage and at every way that that dog is safe and comfortable. That's the biggest thing, that they are comfortable being around that many children and that they are enjoying it, because we've had a lot of dogs that get nervous or they get a little scared, and those are not dogs that we want in children's hospitals around children, around sick children. And the other thing to keep in mind, if you're thinking about doing a child evaluation with your dog, is generally you can only do that evaluation once. So it's important to be very confident in your dog and their ability with children before you subject them to the child evaluation. It can also be very stressful for your dog if they've never been around children and they get thrown into a bunch of children. So it's best to really train and socialize them around children before you attempt to do that evaluation.
Great, thanks so much, Ben.
Mhm.
Another question is there any research using therapy dogs at McMaster University? I can answer that one. In the very beginning, we did do a comparison study between University of Saskatchewan, Regina, and McMaster with therapy dogs. So that article's out there. It's around 2015. Again, you can find under articles on my website. It's there. Ben might be able to type an answer in there if you have the article. If not, Ben, don't worry about it. What else do you have? Could you tell us a little bit about how the course is presented? Is it more Zoom sessions? So the course itself, I can answer that one. I was heavily involved with it. It is not like a Zoom session. Everything is written out. So it's almost like reading a book in a way, but we have a lot of videos and activities. So it's not like just reading a book, so that it is interactive. There are times for you to be reflective, think about your own practices. Like I said, the therapy dog handlers have different aspects in it as well. So there's a lot on there. Different ways for you to work with it. It can also, you could do it over a long period of time. You don't have to do it over a very short period of time. You don't have to sit down for 8 hours. You can keep coming back to it and so forth. And you will get a certificate at the end. So that people really like that as well. Do you allow shedding dogs in the ED? Yeah, Ben?
Yeah, well, absolutely. We dogs are dogs, and hypoallergenic dogs, not hypoallergenic dogs. The thing we ask is that the dogs be well groomed. So that means that the dogs, you know, if it's a period where you have a husky and they're, you know, floofing out, which is kind of in the spring or the fall, that you just make sure that you groom them, brush them out, and minimize the shedding as much as you can before the visit. And you do get volunteer hours for the amount of time that you spend grooming. So if you do have a dog that requires a lot like a husky, you do get additional hours for that. But we open it up to all dogs, and hospitals have great ventilation systems, and they are generally open air, and they can handle a little bit of dog fur.
I can add to that as well, Ben, because I have 2 large dogs, 2 very shedding dogs that go into the hospital. And I know what we do at Royal University Hospital in Saskatoon specifically. You know, sometimes there's a dog that wants to go on the bed. The patient really wants the dog to be on the bed with them. So we've worked really close with like infectious disease control through our local health authority, where, you know, we have a process where we're putting down, you know, bedding, like one of those disposable, like, kind of, I don't know, I don't want to call it a blanket. Do people know what I'm talking about? When you put down, it's like, it's basically like a pee pad. And you put that down. So, you know, once the dog is off the bed, that is also coming off with it straight into the garbage. But also, just as a handler, I always have a small backpack. I bring lint rollers because, you know, sometimes people are hugging dogs. I have a really furry white dog, so there's going to be hair everywhere. But yeah, emergencies are really good because they're so receptive to the dogs. Oftentimes, you know, cleaning staff will also be there in the event that there is a shedding dog, but I don't think there's never been an issue that I've observed in any setting about having a shedding dog there.
I think the only thing in the emergency department that hasn't worked out is if the dog is too big. But that applies to other visiting places as well, because sometimes it's really tight areas, right? So a super large dog may not be best suited for emergency department. And again, depends on your emergency. Maybe you're in a brand new one that's really open and so forth, without a lot of machines and tight spaces, right? So that is one thing that we have looked at when different dogs want to be in the ED.
And I think sorry, I'm just gonna add a little bit more. When it comes to shedding dogs, I think what people worry about is allergies, and I think we worry about it, and I think that some patients worry that other people who are experiencing allergies, and then also things like fear of dogs or not wanting to be around dogs in an emergency department is something that people are fearful for dogs coming into. But what we found, and this is through tons of hours spent at the hospitals, is people communicate with their nurses, the nurses communicate with us, people communicate with us. That open flow of communication means that if somebody has an allergy to the dog and they would rather you not be in their immediate vicinity, that's communicated to us, to our handlers, and we give them that space. If somebody has a fear of dogs, they are given that space. If they would prefer us not to be in an area, we respect that, as does all the St. John Ambulance Therapy dogs, and that we try to provide just a safe, comfortable visiting experience to those who want to visit with us and those that don't.
And we also have up signage, as most people would when you're going into the department, right, into the emergency department and so forth. Another, just Christine and Carl had the comment, I think reading body language, a dog reading body language course is a fantastic idea. We also give you a lot of resources in our course, so it's a little intro of where to look further. And I'm just making a link now to Lindsay Williamson. She is one of the co-directors of our lab. She just did a TEDx talk about her relationship with her dog, who she saw as being a therapy dog, but then came to realize that was not the best thing for him. His name is Steve. That was not the best thing for Steve. And her realization of that, it's an excellent talk, because we always should be asking from the perspective of the animal, do they like this? Are they enjoying themselves? Where's their welfare and so forth? And I think for our team, because we're always asking that question, that's what I think keeps us on a pretty good path, is always putting the dog at the center alongside with the human welfare. Are all of the dogs child tested, even going to regular hospitals, not just children, Ben?
All of the dogs, yes. If a dog is child tested, that means that they can visit the children's units. It doesn't mean that they have to only visit with children. So if you do the child evaluation and you want to visit the children's hospital as well as the other hospital, you have absolute freedom to do that. If you do the children's test and you find out later down the line, I don't love visiting the children, I prefer visiting with the adults, that's up to you. You can have that child certification, but not visit with children. It's just an extra qualification, basically. You don't have to use it, and you can do any mix that you like.
Great. I like Mike here's commented, I have a 12-year-old husky that visits the ER weekly and they are aware of the shedding but love the dog more than the hair. Absolutely. Yeah, I'm just seeing if there's anything else I missed.
I typed a couple responses in, just typed, and then I didn't realize it shoots it into the answer portion, Colleen.
Good.
There was a really nice comment from Lisa Paul at St. John Ambulance. And somebody had asked, is there special handler training recommended to support people in recovery for substance use disorder? And Colleen, as the addictions research expert, I feel like you're the one to answer this.
You know, and actually the study that Alexandria just did looked at suicidality, but also addictions, right? And for us, this is also covered in the course because stigma against addictions is so prominent. So I think from all of the years, like all my research in addictions and mental health, and then all my work with the dogs, I think the more this is my feeling, the more disconnected a person is, the more potential there is for positive impact, right? So individuals we visit with in an addiction treatment center or in a shelter, a housing shelter, when it is substance use, there is just so much stigma. There's so much shame that people feel because of society's response. So that relationship that they can start to develop, or that interaction that they have with the dog, is so important. So again, that's why I think like even module 2 in the course is so good, because it helps you leave and go, right, no, from the language that you're using. So we don't use the word addict, right? Because it's a blaming, it's a label put on someone. But yet, if you opened up the media, it's all over the place. So, right. So how are you supposed to know? Unless you're in the know around that field, you wouldn't know using that term could be potentially disrespectful or harmful or just more stigmatizing for that individual, right? So I love the course for that. And again, that's why I kind of pop into it once in a while, just to, because I can't remember everything that's going on all the time. I want to make sure we're doing this right. And in particular for the dog, right? So making sure that their dog welfare is there, and reading through that body language again is so important. And just thinking about who they are, and then what are the activities you're doing with them after, so that they're in balance as well. Anything else? How about one thing we haven't done, just to end off here? We shared a story. So we didn't have a lot of stories in our presentation this time. We really wanted to push the evidence, so you had that kind of in your arsenal as you go forward. Again, I'm sure those who are handlers, nothing shared here is in anything you haven't heard before in the content or the context of the impact, but hopefully some of the science is there. If you have any questions, please let us know. You can contact us anytime. Any information, we'll be sure to get that off to you. And Alexandria, how about from your most recent study, do you have an example? And then we can end off one from the controlled trial with Ben to think about just where you saw that impact and it really supported some of our findings.
Sure. It was actually doing the visit with Colleen and Molly. It was really early on in our most recent study that we did, and we had gone in to visit with a gentleman. He was about late 20s, early 30s. He was presenting to the ED with suicidality. He was in a really terrible space, not doing well, but also really frustrated. You could tell he was having a hard time, communicating with the staff. He didn't even really know what he needed. He just knew he didn't feel safe and he wasn't doing well. So when we went in to visit with him, Molly actually got right up onto the bed, started snuggling with him. It was really sweet to watch. And this guy when we walked in, he kind of had his armor up. He didn't really want to talk. But once he got there on the bed with Molly, they just started cuddling. He started talking directly to Molly and telling Molly these things, about how he missed his own dog at home and like, oh gosh, maybe my dog is missing me at home. And we all just really visited, talked about animals. We didn't focus on why he was there, what was happening. We just were there to visit, provide support and provide that distraction. And he ended up, I think, about 15 to 20 minutes he's like, I feel a lot better now. Like, I actually feel like I would be okay to go home. And I'm like, okay, well, like, you still got to talk to the nurse and things like that. And the nurse came in, they had, a very brief interaction, and he ended up being discharged with an active safety plan. The nurse came in and basically said, like, you just saved us 2 hours of work because we could not get through to that guy. And Molly really made all the difference. And he even went so far, as we were walking out later, saying, like, I'm going to be making a donation to this program because this was better than any medicine I could have got in the hospital. So it's just, stories like that. Myself as a handler going into the hospital, there's some days that I'm exhausted. I don't want to go in. But then I remember, stories like that and the impact that we can have as volunteers for people just by sharing our dogs with them. Like, it makes it so worth it because you're changing lives for a lot of people by doing this visiting. So yeah, that's kind of my long-winded. That's one of my favorite stories. So
Thanks, Alexandria. We didn't plan that, so Molly appreciates that story. I also think that was Molly's first ED visit, so that was pretty.
her first ever, yeah, and she did great. So.
And Ben, can you close us out here from our controlled trial?
Yeah, I think about, and this was the controlled trial we ran in 2019, so it was years ago, but I will always remember this particular gentleman. When I did the controlled trial, I was often with 2 or 3 research assistants. It was quite a large undertaking. And we went with Wendy and Womble. Womble's this great big poodle, and Wendy's just wonderful. And so we went and talked to this gentleman who we asked if he'd like to be in the study. He said yes. He was just very boisterous, very happy about it. He just seemed, he seemed like he was doing okay. He talked to Wendy and Womble. They went in and visited with him for 10 minutes. And then we came back out and, we went and asked him the questions again. How is your pain? How's your well-being? All these things. And he just, he loudly exclaimed like, oh, it's wonderful. And he told us how he's Greek Orthodox and how he's coming from across the world and how he's just so happy that we're coming to visit him and that we took our time and we just wanted to talk to him. And he said the visit with Womble was just fantastic, but he's loving talking to he's called us boys because we was me and a couple male research assistants that day. He's just like, I'm just loving talking to you boys so much. I just haven't been able to talk to anybody. He'd been in the hospital for 3 days. He had been in the hospital for 3 days. He was dying. He wasn't going to leave. We learned that as we were talking to him, and some of my research assistants were medical students, and they kind of shared with me that information. And he was so happy, and he was so happy that we could talk to him and that we took the time out of our day. He said he loved visiting with the dog, but that he got the opportunity to tell his story to us. We learned all about his life. We spent so long with him after a while, but he was just such a wonderful man. And he had family in Greece. He didn't have any family here. He had been left alone basically in the hospital for days and days and days. And I think that's something that we are starting to address in our research now, is the impact that the handler has on these people, because we are there because we want to be there and we want to visit with the patients, and the dog's an excellent vehicle for that conversation. It's a way to talk about the pets that are past, our life that we've experienced up until then. But some people just want that human connection, and that's something that we are able to provide like no one else. And it's something that sadly is missing for some people in hospitals. We can't assume everybody has family there that they can spend time with. And he just, it brightened his day. I got to see him. We were there a couple of the next days, and so we've got to stop by and say hi. And the next day he was gone, but it's somebody that will always make a huge impact on my life, I think.
Thank you, Ben. It's such a beautiful way to end, because it really does speak to the relationship that we have with the animals, and we really are a team, right? And as Ben said, us being able to address that in research is really important as well. And we're trying to figure that out and struggle with that here, of how you pull the two apart, right? These incredibly empathetic individuals like all of you are, in sharing in doing the visits that you do. Just to end off, I just want to answer Barbara's question there. She asked about research with dementia patients. Absolutely. It is something. We have an article coming out soon. Quite a bit of experience in our office. A lot of researchers at U of S that do dementia work. And I'm actually headed to Scotland in a couple of weeks for the Dementia Dog Project there. So be on the lookout for more in that area for sure, because so important. Such an important health topic right now in society. So with that, it's 1 o'clock. Thank you, everybody, for everything that you do. Thank you for spending your time with us here. We hope to somehow facilitate, you know, this momentum between all of our handlers across the country, get this out as well, so others could watch it recorded, and making sure some way we can stay in contact. And one way you can do that is, again, if you go onto our website, positiveconnectionslab.com, we have a newsletter that comes out quarterly, and there's lots of about our research in it, but also a lot about the therapy dogs, because we do so much in that area. So positiveconnectionslab.com, and sign up for the newsletter on there. Okay, thank you, Ben. Thank you, Alexandria.
Thank you.
Thank you, Molly.
Bye, all.